Hello, you're tuned into daily coronavirus updates. Today is the 28th of April and you're watching The Wire. 29,974 people have been infected by the novel coronavirus in India so far, of which around 22,000 are currently under medical supervision, 7,016 have been cured, and 937 people have died. 1,543 people contracted the virus in the last 24 hours and 684 people were cured. 9 people contracted the virus in Indore's central jail today. A total of 19 people have been infected in the jail facility so far. Indore has over 1,200 cases so far. More than half of Madhya Pradesh's total tally of cases is in Indore alone. A director-level officer with the NITI Aayog has tested positive for the virus. The NITI Aayog building in the national capital has been sealed for 48 hours. A Supreme Court staffer also tested positive for the virus today. He had come in contact with 2 court registrars who had been advised to quarantine themselves. On the global front, over 30 lakh people have been infected so far and over 2 lakh have died. In its press briefing, the union government said that plasma therapy, which is being touted as a breakthrough treatment for COVID-19, should only be used for research and trial purposes until solid scientific evidence in favor of it emerges. The government's word of caution came at a time when multiple instances of severely affected COVID-19 patients recovering through the therapy have been reported. Many hospitals treating COVID-19 have already started storing blood component plasma for the cured patients. New guidelines released by the Ministry of Health has recommended home isolation for patients who have been clinically categorized as very mild cases or pre-symptomatic cases. The ministry has said that home isolation is possible only if the patient has requisite self-isolation facility at their residence and the availability of a caregiver 24/7. The guidelines also recommended that the caregiver and all close contacts of such cases should take hydroxychloroquine or HCQ prophylaxis as per protocol and as prescribed by the treating medical officer. Clinical trials for the HCQ are still underway. Reports of healthcare workers contracting the virus continue to pour in. 1 doctor and 5 other staff members of a Delhi government hospital have tested positive for the virus, taking the total number of COVID-19 cases in the facility to 65. In the government's daily press briefing, the Joint Health Secretary said that if health professionals do not take precautions, they will get infected. But 2 news reports from Chennai and Kolkata show lack of protocol on the hospital's part. In Chennai's Madras Medical College, 23 healthcare workers in total have been infected by the virus. 7 of them have been discharged so far. A postgraduate student from the Madras Medical College told The Wire that 102 students were tested for the virus first, and they were told by the authorities that all students are negative. But later they were informed that 2 of them had contracted the virus. The student additionally told The Wire that Madras Medical College did not test its trainee doctors until they protested. The trainees were neither given protective equipment, not even N95 masks to attend their patients, many of whom often walk into hospitals without knowing they have COVID-19. In West Bengal's Kolkata Medical College, the screening procedure in the general medicine reportedly either failed to catch patients with COVID-19 or were not open about it, which led to 1 senior doctor, 4 postgraduate trainees, 6 interns, and at least 6 cleaners to test positive for coronavirus. To read more about this story, you can log on to The Wire Science. After the Indian Council of Medical Research asked states to stop using rapid antibody test kits and return them to their suppliers in China, a late-night statement by the Chinese embassy spokesperson said that they were deeply concerned with the evaluation of results and the decision made by the ICMR. Stating that China attaches great importance to the quality of exported medical products, the Chinese spokesperson said that the Chinese embassy had maintained close contact with the ICMR and 2 Chinese companies to find out the real situation. She also asserted that it was unfair and irresponsible for certain individuals to label Chinese products as faulty. Besides ICMR, the Indian government has not made any official statements about the quality issues of Chinese medical products. The Chinese manufacturer of the kits won for biotech has issued a statement expressing disappointment at ICMR's decision. The company said that it is confident about the quality of its products and is investigating the ICMR's concerns. Ecuador is one of the first developing countries to face a dire outbreak of the coronavirus. According to official figures, the government of Guayas province said that 6,700 residents have died so far. But according to an analysis by the New York Times, Ecuador's real coronavirus death toll may be 15 times more than the official tally. The coronavirus outbreak in Guayaquil, Ecuador's largest city and economic engine, began in February with infected people returning from Spain. With number of deaths mounting, dead bodies are lying at home and in streets of the city. Reportedly, the city has been hit so hard by the pandemic that overfilled hospitals are turning away critically ill patients and funeral homes have become unavailable for burial. Britain's Pediatric Intensive Care Society has said that in the past 3 weeks there has been an increase in the number of children with a multi-system inflammatory state, following which they issued an alert to doctors that this may be linked to the new coronavirus. Spain's Association of Pediatrics recently made a similar warning. They warned doctors that in recent weeks there has been a number of school-aged children suffering from unusual abdominal pain accompanied by gastrointestinal symptoms which could be linked to the new coronavirus. The province hardest hit by the coronavirus pandemic in central China, Hubei was cleared of confirmed COVID-19 cases on Sunday. The last 12 patients were cured and discharged from hospitals. The existing number of COVID-19 cases in that province is 0. Thank you for watching. Keep reading The Wire and The Wire Science. To watch more videos, don't forget to click on the subscribe button. We will see you tomorrow. Until then, stay safe.